I'm the Chief Nursing Officer, Vice President of Patient Care Services at the University of Cincinnati Health System, Westchester Hospital. I've been there for about 5 years. I've been in healthcare for over 30 years. I've been a previous Chief Nursing Officer at another facility, and I've also spent 25 years in the military and the United States Air Force, and I'm a retired lieutenant colonel. Patient falls are a big deal. In 2008, Medicare came out with some changes with their reimbursement models. So CMS has identified 8 different diagnoses with what they call hospital-acquired conditions, and patient falls are one of them. Medicare no longer reimburses for a patient fall. So if a patient comes into the hospital with pneumonia or CHF, and then they go to the bathroom and fall and fracture their hip or bump their elbow or get a laceration, Medicare no longer pays for that. So the hospitals are hit with that cost of providing that care and recovery for that patient fall. The other thing that's happened is a couple years ago with the value-based purchasing and different things under the Affordable Care Act, there's been some changes there with pay for performance. So hospitals that have a lot of hospital-acquired conditions are actually at risk for being penalized for some of their reimbursements to hospitals based on the number of hospital-acquired conditions that happen. The numbers from CMS and different websites throughout the literature really state about 5 to 6 patient falls per 1,000 days. So at any given point, you could have 200, 300, 400, 500 falls per year based on the size of your hospital. So they're pretty significant. About 60% of those falls will be falls with no injury, but they still have a cost there because if I fall and I bump my head or land on my arm, I might not have a visible injury, but the healthcare team still is required, and from a litigation standpoint, risk management standpoint, they're still going to get an x-ray, they're still going to get a CT. They might keep you an extra day just as observation because you were a fall. So even if you don't fall with injury, you're still cost associated. So about 60% of the falls with no injury cost about $7,000. And then there's the category called falls with injuries. And then that could be a moderate injury. And then that cost associated with that is about $14,000. And then there's what they call falls with serious injury. Those are the ones that need to go to surgery, have a fractured hip, different things. Those cost about $27,000. So when you look at the literature and you base it on 60% non-injury, 30% injury, about 5-10% with serious injury, you're looking at a price tag of just any fall being around $10,200 per fall. So that can add up.